we're really grateful and thankful to have the county health team and public health nurses and other staff come on to help us with our healthcare process.
These county nurses are committed to keeping San Diego County healthy. Here inside this temporary shelter for asylum-seeking families, the nurses are our first line of defense against communicable disease.
The main goal of the nurses is just to prevent any public health issues, so we want to address it immediately so it doesn't cause a public health problem.
We do triage every family that comes through to make sure that they're appropriate to be in a congregate kind of living environment.
All of the families here are cleared by U.S. Immigration and Customs Enforcement and free to join relatives and sponsors until their immigration hearings. This shelter is a brief respite from a journey that can leave these travelers exposed and vulnerable to sickness and disease. Making sure they're not contagious and receive the treatment they need is a top priority.
They'll go to the nurse, and the nurse does a general assessment looking for scabies, lice, chickenpox, flu. Then we take their temperature and just make sure that they don't have anything going on.
If the nurses find signs of something contagious, they can address it promptly to stop it from spreading through the shelter and out to the general public.
We're really careful with chickenpox because that's airborne, or if they had tuberculosis, we want them off-site in isolation.
And while these nurses carefully check for physical signs of illness, they also offer their patients emotional support, reassurance during a time of high stress and anxiety.
And then she knows in 1 week?
Yeah.
Okay, cool. Oh, you're great.
Yeah, I went over the comb
Diane.
and everything.
Each nurse has an interpreter sitting with them, and so the interpreter will ask the questions and the nurse will do the assessment. But let's say if a family has lice, then we'll take them over and do a lice treatment and give them a nice head massage and just make them feel comfortable and really play with the kids, make the kids feel comfortable.
Oh, she's so good.
So we really want to greet them warmly, treat them nicely, and make them feel comfortable here and safe.
Generally speaking, families are here just 12 to 24 hours, sometimes as long as 48 hours, but it's very unlikely that families are staying much beyond that.
I had a family who had 5 kids, a mom and dad, and they walked from Honduras for a couple weeks. They also did some hitchhiking to get here. Then they were in detention for a month, and they were so grateful just to be here. The kids were so sweet and really wanted to play, and that really touches your heart. And they actually left that night on a bus to go to their sponsors.
Making room for the next family to stop in and be cared for by our county nurses.